Hi, What the Health Tech listeners. I'm your host this week, Rebecca Linley, and this is the podcast where we tackle some of the trending topics, ideas, and best practice within health and social care. In this episode, we'll be diving into a topic that's shaping the future of our sector, sustainability. We'll be covering why it matters within health and social care, how it impacts organisations, staff, patients, and the wider community, and practical steps providers can take to make a real difference. Today, we're joined by Hannah Montgomery, Marketing, Sustainability and Care Lead at Grace Cares, to break it all down. So welcome to the podcast, Hannah.
Thank you for having me. Thanks for inviting us on. I appreciate it.
So can you start off then just by introducing yourself, your role and Grace Cares' mission?
Yeah, no worries at all. So Grace Cares launched on Valentine's Day 2 years ago, and we're on a mission to make care sustainable. So we are a not-for-profit and we're based in the Lichfield kind of central location, but we support care providers across the UK. So we take in pre-loved care equipment. So we have partnerships with 4 NHS trusts at the moment and with Staffordshire County Council. We've just started one with Stoke Council as well, where they donate their used care equipment to us. We clean it, we maintain it, we do Lola testing, PAT testing, whatever it needs, so then it's ready for resale. Then we resell it at half its original price or less. And then with those profits, we offer hardship grants to health and social care workers nationwide, and also to older people. So that's anyone 70 and above and their families. And we also do social value stuff. So we do monthly kindness rock painting for residents in care homes. We go into care homes and also do biodiversity work. So we might look at the gardens and do bird baths and bug hotels and bird boxes and stuff like that. And then we have monthly tea parties for those that live on their own at home. So stuff like that. We also then support social care providers with their ESG journey. So we offer training support there. We have a quarterly webinar called Caring for Tomorrow, which any care provider, whether they're dom care or care home side, are more than welcome to come on board and have a look at. We have live case studies there. And we also have workbooks and resources for that as well.
Wow. So you're busy then.
Yeah.
Well, thank you for sharing that. Just to dive straight in then, so setting the scene, can you tell us a little bit more about why sustainability matters within health and social care?
Yeah, so if you kind of think about it, health and social care is part of the planet. So people get poorly. So there was a girl that Southwark Council ruled a girl actually died of air pollution. So imagine there's somebody in a poor air quality zone, they're breathing that in, then they get more complex health needs, which is going to put an even more strain on health and social care providers. So if we can make the planet better, then we're in a nicer environment, we're eating food from better soil, we're breathing better air, that then hopefully will give us less complex needs going forwards and less strain on the sector that's already crumbling.
Yeah, I mean, I think that is just such a key point, isn't it? And we've just been talking about, I'm just going to show to the camera, this book here, and having Earth as almost like that stakeholder within the room, within every conversation that you're having. And I think within the book, they kind of reference why they think that Earth is like the biggest and most important stakeholder. And it is because it is the source of all materials for everything that we do, from food, resources at work, that kind of thing, buildings, all that kind of stuff. It is the home of everything.
Absolutely. And small differences can make a huge impact, like just in a care home, for instance, just turning that thermostat down just one. Or, maybe not having it blasting out while all the windows are open. How many care homes have you been to? And that's been the case. So, and that can make it then a huge impact, but it's measuring it and knowing what you're doing in the first place, isn't it?
Yeah, definitely. So just building on that then, looking at the wider picture and regulations and governments and the government targets and things like that. So I've got a stat here. So the NHS has committed to net zero by 2045 with the government targeting 2050. So how does this kind of impact on the sector then?
Back in 2019, at the United Nations, the UK was the first major economy to go, we're going to be net zero by 2050. So that's cool. And the United Nations have identified these sustainable development goals. They call them SDGs. So it's it's very much worth people going and having a look at those if they haven't already, and almost seeing where they fit with what they're doing and how they are going to contribute to better outcomes via those sustainable development goals. And maybe that's how they set up their policies. So we've kind of signed up, the government have said it, we're doing it. So the NHS are further down the track. So I've got a stat. If a health and social care sector was a country, it would be the 5th largest greenhouse emitter on the planet. And the NHS is responsible for about 4% of the nation's carbon emissions, which is mental.
Yeah.
So if we look at what NHS have got, so they've kind of broken down and they've got more stats. Social care hasn't got that yet. So their biggest kind of emission contributors, there's 24% of their supply chain, 20% is medicines, 10% is medical and care equipment, and 10% is building energy. So maybe when care providers are looking initially on what their carbon emissions are, maybe if they look at those 4, because we know that they're the largest emitters for the NHS, then that can give us maybe some guidance as to where to start on social care side.
Yeah, so kind of look at those 4 areas, see what they're kind of outputting from those 4 areas, and then build, I guess, the government's goals within to their own policies as well and procedures.
Yeah, and not just have, how many policies do you have? If people, I've been to places where people go, I've got an ESG policy, or I've got sustainability
yeah, but do you
policy.
follow it?
And
yeah.
I'm like, what does it even say though? What does it follow? And if it just becomes another piece of paper on a shelf that never gets looked at, so how regularly is it reviewed? Or can every single policy should have, and so the CQC are regulating now on, it's called environmental sustainability. So that's the term they're using. So maybe use that term throughout all of the policies that you're doing. So it's because the CQC inspector isn't going to know everything either. So if you map it out exactly what they're saying and go through every single policy and see how you're going to make it, you're going to add a environmental sustainable angle to it.
I think that's a really good point, isn't it? And actually having your staff understand those policies too, because it's all right just having it written down on paper, but if your actual workforce doesn't, 1, know it's even there, or 2, understand what the actual policy or procedure is, then the CQC regulators and things like that, they're not going to be impressed that you've got a document with it on. They want to see that actual evidence too.
Yeah, so I've pulled up, so I've made sure that it's the most up-to-date thing from the CQC websites that are up-to-date. So in terms of best practice guidance, we expect providers to be aware of and follow the following best practice guidance: carbon reduction, including travel, medicines and supply chain. So maybe they've looked at what the NHS are high on. I don't know why they would say that too. Travel, estates and facilities, and extreme weather. So we would recommend you ask yourself, are your staff, people using your service and other stakeholders aware and actively engaged in planning for and responding to the potential impact of climate change? So I suppose if all staff listen to this episode, right, and there's evidence that that's happened, that's a tick point, right? But maybe the starting point is for evidence for the CQC is a survey that goes out to staff, goes out to residents and family and to other stakeholders, asking them, whatever is relevant to the care provision.
I think that's a really good point, isn't it? And then that leads me on really nicely into something else that I wanted to ask. So just kind of like real world impact for staff, residents and communities then. How does this kind of influence the workforce's well-being, retention rates and recruitment as well in care homes in particular? We'll start with.
Yeah, no. Well, actually, because it was you that recommended the Can Marketing Save the Planet book, and I've only just started reading it. I'm not as far through, but they highlight that Gen Z, which I mean, it's the most 95 to now, I think that's when Gen Z are now, their values and what they're looking for from companies is changing. There's a general rule that they are always scared of having children because the planet is not going in a good direction, and they're fearful of that. So if we've always got a recruitment and retention issue within social care. If you can position yourself as being, a sustainable company to work for, then that's only got to be good. And actually, maybe that puts you towards maybe reviewing your whole company mission and values. So instead of just then having a policy or throughout all your policies, actually, what is the overarching business strategy?
Yeah.
We've done a review with our residents, we've done a review with our staff, we've done a review with other stakeholders, they're committed to it. Our funders, like banks at the moment, or tenders that you're going for, you have to be showing your ESG credentials. So actually, maybe if that's throughout every stream of your organisation, then that's something that's going to help with recruitment and retention.
Yeah, 100%. And I mean, that's so true, isn't it? That a lot of people nowadays will not work for an organization if they don't align with their own values. And I think that works both ways, B2B as well as B2C. We, for example, at Radar Healthcare, we've just started an ESG committee. And I mean, it's brand new. We've only had one meeting. But the purpose of that is to kind of, one, obviously, become more sustainable as an organisation, and with that become more profitable, but also align with our partners' goals and values too, because there's so many, we talked about this earlier, didn't we, just before the call, but there's so many bids and tenders nowadays that ask those sort of questions, like how sustainable are you as an organisation, what is your carbon footprint, and those kind of things.
The lenders as well. So the banks are having more pressure put upon them. So therefore, they're then lending based on the impact that's going to have on the environment as well. So you've got that kind of side. And also, I might be somebody that is looking for a care provision for a family member. So it's me that you're really marketing to. And if, my values are more about sustainability led, then you're going to fill your home or fill your dom care roster more from that side, as well as getting staff is also going to attract the right kind of clients.
And that leads on perfectly to my next question. It's almost like it was scripted. So what are the benefits then for residents and families as well then around sustainability? I mean, you've just kind of told us one, I guess.
Well, it's the right thing to do. So then it shows if you're caring for the planet, then you're caring for people. It's kind of a circular economy of that, isn't it? It's a cycle. And there's ways that you can get community, that the care homes can get the communities involved. So I know that you said that you've got your ESG meeting, which is cool, and a lot of care homes then for their evidence and dom care providers will have on their weekly meeting that on the agenda. But we do an intergenerational campaign. So we get local schools, colleges and universities involved in a project, and then our older people that we support are the VIP judges. And it kind of, one, breaks down that barrier of the older people thinking the young people are just hoodies and the younger people just thinking old people are just slow and they won't get out of my way. But it also gets awareness in PR. It also then takes some of the pressure off us. So care homes, maybe if they could get their local communities involved as well, that then highlights sustainability, great, but it's also then going to attract people to want to have their loved ones cared for by someone that's, a community active company.
Yeah, and it goes back to that values piece, doesn't it, as well? If this is something that you value as a person, then you're going to want to put a loved one in an organisation that also aligns with that. And then, so just top tips then. Do you have any top tips on how organisations can engage with their local communities?
Straight away, if every local authority has an economic development lead, I'd reach out to them straight away. Also, funding, there might be funding available, so that's always a good link to reach out to. I know there's a UK Shared Prosperity Fund that's just had an extra bit of money in it, especially where we are at the moment, so that might be nationwide, I'm not sure. Well, some things that the care homes have been doing particularly is opening up their gardens and having like allotment space so the local community can come in and help cultivate the fruit and veg, and the residents can see that that's happening. And then there's almost the shared food, or they'll have like the wormeries in the garden, and they'll have the school children that will come in and get involved with that as well. So just inviting the outside space in. I know there's UK Care Week as well, so maybe people could do something alongside that could have an environmental stance on it as well. That could be a a nice
Yeah.
double-edged sword, and then it gets you the positive PR as well.
I like that. I like that idea about opening up their almost like their spaces and inviting people in to help out and volunteer and stuff like that. We have sorry, I keep plugging Radar. I'm not meaning to. It's just coming
No,
to me every time. But we have a charity day that we can use basically, and a lot of our staff do things like that. They'll go to their like local area or a partner that we work with and kind of try and help out.
yeah, it's just the right thing to do, isn't it?
Yeah, and it's such a like one of those things where you go away feeling good about yourself as well. So it's like it's got two benefits to it. You're also helping that organisation, and you're also getting
Help us
the
hide, we call it.
yeah. So then just moving on to how organisations can become greener then. So I have some more stats here. So care homes on average use 2.5 times more energy than the average home, and 133,000 tonnes of plastic waste annually. So do you have any top tips and on best ways to kind of cut consumption and reduce waste?
One top tip, the Royal College of Nursing did a study called the Gloves Are Off campaign, or Get the Gloves Off campaign, something to that ilk, where they then trialled not using the plastic gloves through practice, and the infection rate never increased. In fact, it decreased because it made people wash their hands more regularly.
Yeah.
And then they cut out, one, they saved money because they're not purchasing all of those plastic gloves, and they've saved that the emissions of those even being made, and they've lowered infection rate. So if a care home or a dom care company was scared to put that as a trial, they've got the evidence from the Royal College of Nursing backing up that it is potentially the right thing to do, and them trial it. That's something. A single plastic audit, that's quite a nice thing to do straight off the bat. So identify all of the single plastic throughout the care delivery and see if you can just get rid. Or if you want to show the CQC that then you're or the care inspector, or wherever you are, that you're then evidencing that you're slowing that consumption down, you could have your target that you want to reduce it by 50% by X, and then look back at it and go and do a review. We do, if people aren't already aware, as of March this year, so just gone, food waste has to be in a separate stream now, and we do kind of a bin amnesty every quarter. So we've got volunteers that come into the unit on different days, and we've got different people coming in and out. So I've got plastic tarpaulin that goes out the front. We video me looking like some crazy lady that puts all the stuff on the bin. I'm like, why? I think there's one volunteer particularly that just puts a can into the paper thing every single time just to get me. But we then video it, and if we've got more in the correct streams, then there's like treats, and if not, it's like, oh, why not? To try and almost have that culture of then everybody, when they see this one volunteer putting the Coke can in the thing, going, no, that isn't where that goes, because you have to change the culture. So whatever it is hasn't got to be something that's onerous. It's got to be something that that people are going to want to do. Let's be honest, a care manager has so much on their plate anyway, and then now it's like, we're not going to take anything off you, but could you also be environmentally sustainable? I don't know what that means. I haven't got time to figure that out. I've got Doreen that's done a runner out the care home. I've got the CQC coming in. I don't know. So it's trying to make whatever you do relatively fun and evidence, something that you can use for evidence as well.
Yeah, and I went to the care show last year and went to a session, and a care home manager was basically talking about how they've made their organisation more sustainable by doing almost simple, small tasks that make a really big difference. So one thing that he mentioned in that session was around like automatic lighting within central areas, so that the lights aren't always on and they'll come on and there's no delay or anything like that. They've made sure of that so that someone's not just stood in darkness waving their arms around and stuff like that. But yeah, just small things like that, I think. And I think this is probably a really good time to mention your book that you did as well.
Yeah, cool. So thank you for that. I appreciate it. So here is the book. did you deliver sustainable care today? The sustainability guide for care managers. So I wrote, it's quite a chunky book, but it's got evident, you can kind of fill in your own charts on it, so it's like a workbook, but it's all relevant to social care. So I wrote this alongside Mark Tops from the Caring View, because he's got obviously the social care background that I haven't, to almost sanity check everything we've put. But all of this is kind of been written that each chapter you can dive into. So one chapter is about doing an energy audit, one's about assessing your carbon footprint, one's about top tips from other care providers. So even if you've analysed your carbon footprint, then you can flick to another chapter to do. So each chapter can almost be its own module in itself. So it gives you a breakdown of what all the regulators are talking about, what the local authorities and the government have been saying, and the UN, and kind of background on figures. And then there's workable elements throughout it to kind of work. Also, I went back to university last year, to Aston University, and did a Green Advantage course. And part of what they gave us was some resource to do a sustainability roadmap, to kind of map out visually what you're doing. And we've got one printed and put in our foyer for all the visitors, so they can see where we are. It's a visual thing that's always on show. So they've been kind enough to allow that resource within this book, so people that purchase it can download that, print it off straight away, do their own sustainability roadmap, have it on their staff exercise, or maybe as people come in, I don't know. But then there's visual aids throughout it that you could be using to then show the CQC when they come a knocking.
Yeah.
That it really is.
I love that, though. It's almost like that. It goes back to something I was saying yesterday in another podcast around, if you're constantly having that conversation, because it is such a culture change if you haven't been doing this already in practice, that if you're constantly having that conversation about sustainability and having those almost visibility, that, like that you said, that poster on the wall and stuff, and people can see it, then it's always in the back of people's minds, rather than a conversation you have once a year during, I don't know, Earth Month, and then you don't speak about it again.
Well, it's the impact then as well. So yes, we're going around switching on the lights, or we've changed it, or we've got these solar panels, but then what saving does that mean? And then help that be something that the staff can understand. Well, obviously I've set up a not-for-profit, so my brain is probably working to the point of, okay, could we incentivize staff that if our goal is to reduce scope 1 and scope 2 by 80% by, what's the NHS, by 2038, if we hit that, and this is the monetary that we will have saved, then you get a bonus because we've saved that money, therefore we've got that money. Yeah. Is that a way to then have that culture change that everybody, Susan, turn off the light because that adds to our bonus? I don't know.
Yeah. No, I think you're right. I think it's speaking the language of the stakeholder. And that leads really nicely into another question that I had, which was just around like how do you almost sell sustainability to different stakeholders within the business, because it is such a culture change. And I guess depending on who it is you're talking to, they might not see it as a priority because of their, I don't know, giant list or whatever. So yeah, how would you kind of recommend that to people listening?
Yeah. One, the monetary side, if you can tie it in with targets and that there's some kind of reward to it, so people feel like they're in it together. Like you've said about it being highlighted at every single meeting, it being on an agenda. What would the planet think? I think that's such a lovely, yummy way of adding that as a stakeholder piece. But as we spoke about before, the initial surveys, find out how people are feeling now, and then do a survey in 6 months, see if they're feeling more. So you'll know if you've made a change, but you'll know what the baseline is. No, I don't care about it. Oh, okay. Why don't you care about it? How could this be something that would be made important to you? What do you know? And it's an education piece, isn't it? You don't know what you don't know. So why would you want to make your job harder unless you know what the benefits are? So I think it's just been really clear and communicative.
Yeah, I think that's a really good point, isn't it? It sometimes it does come back to that awareness piece and people not understanding the big impact that these small, well, not small, because obviously it is a long-term thing, but these changes make not only to the planet, but also to their business too, because at the end of the day, care organisations. They are businesses, and they are obviously working for profit. So that leads really, really nicely into the next bit around, I think there is a little bit of a stigma around sustainability being quite costly, but that's not the case. Well, that's not the case, is it?
Not always.
No,
I have
not always. Yeah.
So one of the things that I did last year, so because we're partners with the NHS, one of our NHS partners got us onto this talk. It was called MPAG. Now, I don't know what that acronym means, but it was all the waste managers from the NHS. When we were on there was RAP and DEFRA were on it. So then they asked us to help them with a board that they were doing to produce a website called the Business of Recycling. So if anyone goes on to the Business of Recycling website, it's really good. It can be broken down for healthcare, but also social care, and give you kind of top tips, resources. So, around the unit, we've got this bin is for this bin is for that. Instead of me having to design it, there's all those templates on there. So I would definitely say go on there. But part of what they were doing was using a software called Miro. And Miro is like a online sticky note system. So I totally copied it. The system that they were doing. I was like, that's a great idea. And last year we did 8 sessions called Caring for Tomorrow Collaborate. So we invited care providers of any size, any kind of care provision to come on and talk about what they were doing at the moment, what barriers and stops that they had, what they could do, and then all agreed by one position that this is what we're going to do by the next meeting. And then they had this working document that they could access. So if at any point the CQC came a knocking, they could show it.
Yeah.
So I collated all of the things that everybody was doing in order to kind of take an idea or two from that. So staff onboarding, some care providers would one, including it in staff onboarding, but providing then a pack of reusable branded items like a thermostat for when they're out and about. So the reusability is almost there straight away, and sustainability is kind of in a nice way because they've had something from that. Even in terms of clothing, make sure that it's kind of bamboo or recycled, or that you're getting rid of that, or you're using a supplier that's got sustainable credentials that you can send it back to and they reuse. A quick, easy one is going to all of your, what am I trying to say, all the people that you buy from, all your suppliers, and ask them what their policies are. One,
Yeah.
look at their policies and they might give you some good ideas. But then if you put as an annual review, we're going to make sure that all of our suppliers have a decent ESG policy, and we would not then get into bed with a new supplier without this. Money really talks. That's quite an easy one, is having a look where your pension pots are invested or what your bank is investing in, because if it's oil and all stuff like that, maybe it would be worth looking at having a more environmentally savvy fund pot that your pension goes into. You can evidence that to the CQC and you can review that every 12 months or however you want to put your policies within that. So that's something showing that you've thought about it. We've spoken about policies and making sure it's kind of in part of everything. But data is absolutely king. You can say that you're doing certain things. So in terms of figuring out what people need to measure straight away, if they look at their water expenditure, they look at energy, their technology, their transport and business travel, as well as their suppliers, that would be a good to get you where are you now? And then for each of those go, right, okay, within 12 months, we're going to reduce that by 20%. I don't know, but then hold yourself accountable to that. I know that the local authorities, especially in my area at the moment, are offering companies free energy audits. So once again, reach out to local authorities, economic growth team, and see if there's any funding available, or if anyone could come out and do an energy assessment. We have here, so we're based in Staffordshire. So we have a company that's run by Staffordshire County Council called SBEN, Staffordshire Business and Environmental Network. We're also involved with Sustainability West Midlands. So I know there's different ones in different areas. So try and find if you've got that resource as well. They're a good point of call to go toward. obviously calculating your current carbon footprint, which is kind of your greenhouse gases and emissions. So there's three scopes. The scopes 1, 2, and 3. Scope 1 is a direct emission from something that you've done. So if you're going into the garden and you're burning, then you're making that energy. So therefore, that's a scope 1. So there's not a huge amount of scope 1s normally. Then there's scope 2, which is indirect. So like it's more likely to be electricity and when people are traveling on your behalf. So today, maybe you've travelled to the studio for today, right? So that would be scope 2 for radar. And then scope 3, and this is why the NHS have given themselves 10 years from 2040 to 2050 to look at scope 3. Scope 3 is everything else. So a nice way for care providers to start having a nod to scope 3. So if residents are getting visitors, maybe in your visitor book now you could ask the visitor, and they might not want to disclose this information, but maybe they would, how they got there today, how many people came with them through that, different modes of transport, how many miles, where was the original starting point, because that can then help you do that scope 3 analysis, at least for the people that are travelling to you. But that's a huge, bigger beast. But at least know what your carbon footprint is and calculate it and put a rule as to how you're going to do that. So we're currently calculating the carbon footprint for each piece of care equipment that we have. So anyone that purchases anything through the website, so we've got a care home group, Coat Water Care, that have set up different accounts for different care homes. So therefore they can go on and pull off reports of the carbon footprint that they've saved just through purchasing through Grace Cares. But when you are calculating carbon footprint, you have to use metrics that are from DEFRA on the government website, and they change annually. So it's an exercise you have to keep doing. It's great fun. So don't be caught out by that one. Also, if companies are of a bigger size, so lots of the care providers that are big will have to do ESOS to be compliant with something. So they're going to have to be doing their carbon footprints anyway. But I would recommend that the care provider at least understood how to do the calculation themselves. I mean, I know it's going back to the book again, but there's an exercise that will take you through how to do that, because on the government website, the metrics that they give you for calculating the carbon change annually. So if you're relying on a carbon calculator or an AI bot to do it, it might not be pulling the right data. So you might be, unbeknownst to yourself, not doing the measurement correctly. So just to double sanity check, I'd try and do it yourself.
I mean, I think you've given us so many different takeaways from just that one section that people can kind of take on board and try and implement and understand where they're at with all of this. And then obviously from there, set almost smart targets to then achieve better results and also reduce the cost outputs and things like that too. I know you mentioned earlier about that organisation that stopped using the plastic gloves, for example, and it had multiple benefits. So yeah, there's different things like that, isn't there, that where you can, I think what I'm trying to say, waffling a little bit, is that I think there is a bit of a stigma around sustainability being quite costly, and I think in some cases, like you've mentioned, that it can be quite the opposite, and it can reduce costs and actually be quite profitable.
Yeah, no, absolutely. And then just kind of thinking outside the box, it can enhance your reputation. So Sanctuary, they're huge, aren't they? And I was on a panel with their kind of ESG lead, Alice, and she said they were looking at food waste and they produced 30% less food waste just by, they were finding that the chefs were filling the trays that were going into the oven. So they bought smaller trays and therefore, without really trying, and they gave 2 choices at dinner as opposed to 3. So there was still person-centred, it was still, choice was there, 30% less food waste. Isn't that mad? Yeah. Just by such a small change.
Yeah, and I think as well, sometimes too much choice is almost a little bit overwhelming, I guess, too, because you then thinking to yourself, oh, I don't know, I'll have a bit of everything or whatever, and then you get sat down. I mean, I'm a prime example of this. Eyes too big for my belly. I'll fill my plate and then you're like, oh, I've got leftovers now for three weeks.
But it's also the social value stuff. So could care homes then look with those leftover food to put it on a Too Good To Go app or an Olio app or something like that? And also, what's worth considering is the carbon footprint of the food. You can make some real quick wins by, instead of having, New Zealand lamb, or get UK lamb, so that the miles that food has travelled is less. That would still be a scope 3 kind of emission thing, because it's from your suppliers. But
yeah, it's just being innovative with it, I guess, isn't it? Like you just said. And that brings me on really nicely, actually. There's obviously the buzzword at the minute. I mean, it's been going around for a few years, hasn't it, around digital transformation. And I've got another stat here on my paper of scribble. So moving from paper records to digital systems can cut emissions by 60 to 70%. So going back to kind of like the benefit for a business in particular, what's the kind of business case for this shift?
Well, definite as well. And it's not just that the tech is saving the paper, it's also creating better care, because it will alert you when things are going wrong. But if we go back to the NHS figure, I think it was 20% carbon footprint in terms of medicines, and the waste with medicines and the reordering of medicines that aren't necessarily needed, and then you can't get rid of them. Digitization of that system, surely that's just makes sense, doesn't it? It's going to help you reduce waste and therefore save money and be more compliant and show more evidence. Digital transformation 100% goes hand in hand with ESG, doesn't it?
Yeah, and I mean, like you take a look at virtual wards, for example, that's cutting travel emissions massively, isn't it, for people too?
Yeah, and stopping the bed blocking. Obviously, it's about £600 a day for someone to be on a general ward as well. So it's just
crazy
trying to get people out quicker.
Well, unfortunately, we've come to the end. But I just wanted to ask 2 final questions. Well, 3 actually. So maybe we're not quite at the end. So one is there a message that is there a message or key takeaways that you want providers to kind of take away from this that are listening?
Don't be scared, make it fun, and just start with measuring at base level before you get started, because then you'll go back and go, but we've done all this good stuff, but you never got the first measurement. To get those first measurements and just try and make it fun. Introduce one thing, you've not got to do all things, and get everyone on board, everyone's input. We're thinking about doing these things. We've got these 3 things we're thinking. You've come back to us and we've said this and you've said that, and get everybody involved.
Yeah, I think that's really key, isn't it? And it goes back to that feedback piece, those surveys, trying to get people's input from like the start, so that people you understand the language that you need to speak to these different stakeholders as well. And also going back to that fun element of trying to make it interactive and not overwhelming. I think, like you said earlier, around care home managers in particular, they have a long list of things that they need to do day to day. So you don't want to add on to their list of things like, oh, now you need to be an expert within sustainability. It's almost like, how can we take the practices that we already do and kind of embed that within our culture?
Well, think about it. If a care manager, just from being on here, now knows that we signed up to be the first major economy to be net zero by 2050, and from the United Nations and the Sustainable Development Goals, if they can recite that back to a CQC inspector that comes through the door, they possibly already know a little bit more than that CQC inspector. So also don't be scared of it, because how are the CQC equally going to have to be environmental, professionals? They're not. And anybody that tries to sell you, I can give you this, I can do that. Not everyone's an expert. We're all just learning as we're going, and it's all a new thing. So don't be put off by other companies that are saying that they're doing all this fancy stuff, because they might not be.
Yeah. And then my final question before the What the Health Tech moment then is just around, where can listeners go to find more resources and support?
Yeah, so our free webinars, Caring for Tomorrow, the next one is in May. So if you go to www.grace-cares.com, you'll be able to sign up for those free ones in there. We also have a free taster version of the Sustainability Guide for Care Managers that's available on the website as well, or you can purchase the full workbook as well. And the next thing that's hitting us is the Care Show London, the 30th of April, the 1st of May. We've got an ESG panel there that might be, if people are there, people might want to come along to that on the 1st of May.
Oh, amazing. And I'll plug all Grace Care's details as well within the description and everything, so that if there is anyone listening that wants to find out more, then they can just easily find the link and everything like that.
Cool.
So yeah, my final question, and I promise this is the final question now, is at the end of every episode, we like to ask our guests what the HealthTech moment is. So essentially, it's just a memorable moment within health and social care, and we've had everything from kind of the weird and wonderful at this point. So yeah, if you are happy to share what the HealthTech moment with us, please.
The most memorable moment in health and social care. Oh, gosh, I suppose recently there's been a very good memorable moment of the marches that happened to kind of providers unite about the changes that are happening with national insurance and the state that we're in there. So I think that was really showed the united force of health and social care.
Exactly. Well, thank you for sharing that. And it's been great chatting with you, Hannah. And thank you for sharing all your insights. And like I said, I'll tag Grace's Cares in everything below as well, so that people can explore that page and find out more and get access to those support resources and stuff like that. Thanks for listening, and join us next time for a brand new episode. And if you have any questions for us or our guests, please email whatthehealthtech@radarhealthcare.com.